my name is Meg Didier, and I was born with a congenital heart defect called hypoplastic left heart syndrome in 1991. From a cardiac standpoint, my journey has been nothing short of stellar. I grew up incredibly active and competed as a high-level gymnast for nearly 15 years. From the outside looking in, it appeared as though I was living just as normal of a life as anyone else. Mental health was never a discussion in clinic beyond asking if I wanted to hurt myself or others. You become accustomed to having to bury concerns, fears, worries, and anticipatory grief of what the future may hold. Why would I be struggling with mental health if my testing from a cardiac perspective is looking great? My yearly appointments turned to wondering if this appointment was going to be the one where I find out things are beginning to go downhill. Will my entire life be uprooted, and will the plans I have be set aside, or worse, never be able to come to fruition? I felt like I was treading water and had no validation that the feelings I was experiencing were common. I felt completely alone and isolated with no one to turn to. From my perspective, there are 3 actions that can take place to start addressing emotional health and care today. The first is communication. Start early, ask often. You are the main point of contact for patients and families. Even though you may not be a mental health professional, you can make a difference by providing an open line of communication between the patients and their care teams. The second is validation. Understand that each patient and family experience is unique, no matter the diagnosis. Many patients feel heard and understood by validating each individual experience. By providing validation, you are showing each patient and family member that you care and are supportive through every aspect of their journey. The third is resources. Share information to connect patients and families to the resources that they need, including in-house and outside resources such as peer-to-peer support. Now, more than ever, there is access to many forms of support through in-person and virtual options. Take the opportunity to identify those resources that could directly impact your patients. Mental health is a crucial part of patient and family journey. Validation and acknowledgement by their team can go such a long way. Almost every aspect of our lives is ran by our teams for their opinion. Creating a discussion surrounding mental health is truly just as large of a piece of our care plan as any other. By taking the time to ask questions, validate experiences, and acknowledge feelings, you have the power to change the way the patient views their entire life in chronic illness.